I think we will go ahead and get started. My name is Allison Barkoff, and I have the privilege of leading the administration for community living. And it is my honor and my incredible pleasure to welcome you to this overview of ACL's update to the regulations for our Older Americans Act programs. This is truly a historic and important step forward, as the last time we were able to update our program regulations was in 1988. And I know I don't need to tell all of you how much the world has changed for older adults in the last 36 years. For example, the number of older adults has nearly doubled. People are living longer than ever before, and expectations for aging have changed significantly. The importance and the impact of the work of our networks has become increasingly visible as healthcare systems have shifted focus to keeping people healthy over just treating illnesses. Our networks are truly in high demand as partners. The Older Americans Act has been amended 7 times and reauthorized 5 times since 1988, and there are many important programs that have been added since then. So that's why we decided it was a critical time for us to update the regulations. We know and heard from you that outdated regulations can result in inconsistencies and a lack of clarity, and we're making it harder for the aging network to manage programs. Updating these regulations also provided us an opportunity to highlight the incredibly important focus of the Older Americans Act on reaching the most underserved and in need, and to incorporate in lessons learned from the COVID pandemic. Before we proceed with a detailed walkthrough on the rule, I want to start by thanking the Older Americans Act rule team here at ACL. We had a core group of dedicated ACL staff who has truly worked tirelessly for almost 2 years to make sure that these regulations will be as helpful as possible to the aging network in the critical work you all do every single day to support older adults and family caregivers. And I want to thank the program managers and staff within the Administration on Aging, as well as the regional administrators and staff from across ACL centers responsible for fiscal reporting and other program coordination areas for the collaboration in preparing this final rule. As I always say, this has been a one ACL effort. I'm really proud that we focused on how these regulations can support effective, accountable, and really respond to local needs when we're implementing the Older Americans Act. Again, with a focus on those in the greatest economic and social need, with the ultimate goal of better serving older adults and family caregivers. I also want to thank all of you in the aging networks. This is much your rule as it is ACL's. Your input has helped shape this rule. We've informally engaged with the networks. We had a formal request for information, and then we put out a notice of proposed rulemaking last June. We are so appreciative to have received your comments, particularly in response to the proposed rule. They helped let us know that we were on the right track and helped us know areas where we needed to make refinements or clarifications in the final rule. So I think you will see your fingerprints all over what we're about to walk through. As we turn toward the work of implementing the final rule, I just want to note that it's important to remember that the vast majority of what's included in the final rule are long established Older Americans Act requirements and practices that have been going on in the field. In other words, really reaffirming what's in the law, what's in prior regulations, and what's in existing policies. But of course, we know that there are some new requirements. As you'll hear from my colleague, Amy, in a minute, we know that it takes time to implement rules. And so the final rule, while it goes into effect on March 15th, we have a longer time frame for states to come into compliance, and that's October 1, 2025. And don't worry, you are not alone in the important work of implementation. Between now and then, ACL is your partner. We'll be providing robust technical assistance and other resources to support the aging network in implementing these new rules. And as you'll hear from Amy, we can partner in lots of different ways if states need more time to comply with specific provisions. Next, you'll hear from Amy Watra Rodriguez, who directs ACL's Center for Regional Operations. She'll walk you through the final rule and provide a little more detail about our very extensive plans for helping the aging network implement these final rules. And then you will hear closing remarks from our incredible Deputy Assistant Secretary for Aging, Edwin Walker. I just want to say to everyone, this has been just an incredible capstone to the career of Edwin Walker, who, as many people know, are retiring next month. It was something he was committed to getting done before he left. And I just want to say, Edwin is leaving his legacy and 32 years of strength leading this network in these regulations. So thank you, all the hearts and claps. Edwin is amazing. So we are very excited that we have this final rule to support the aging network, to make our systems and services stronger, and to position us well as we go forward, looking at the Older Americans Act programs and beyond. And with that, I will turn it over to Amy.
Great. Thank you so much, Allison, for those wonderful welcome remarks and for your steadfast leadership to get us to this exciting point. In my role as director of the Center for Regional Operations for ACL, I work with the regional administrators, the Administration on Aging, and across ACL in implementation of Older Americans Act and other programs. I'm pleased to be part of the team working on these Older Americans Act regulations, and we all look forward collaboratively to working with you and across ACL with the entire aging network in implementing this final rule. As we move along in our presentation for today, we'll follow the agenda on this slide. We'll start by discussing some background information so we're all on the same page. Then we'll provide an overview of the final rule. This final rule covers Titles 3, 6, and 7, so there's a lot of content. And we'll give some examples of key focus areas and provisions of the final rule. My portion will end with discussion of our implementation timeline and resources. And as Allison said, our presentation today will conclude with remarks from Deputy Assistant Secretary for Aging Walker, whose vision and leadership has been instrumental to decades of success of Older Americans Act programs. We go to the next slide. Many of you are likely familiar with ACL, and for those of you who are not, we want to welcome you as well and share that ACL's mission is to maximize independence, well-being, and health of older adults, people with disabilities, and their families and caregivers. And that mission corresponds with the vision statement on this slide. As an operating agency of the Federal Department of Health and Human Services, ACL's leadership role includes serving as an advisor on aging and disability within HHS and across government, administering funding and programs authorized in statute like the Older Americans Act, and providing a range of other technical assistance and advocacy roles. So in particular, establishing regulations to implement programs like the Older Americans Act is one of those important leadership and administration roles. If we go to the next slide, since I'm not sure how familiar everyone is with the federal government lingo of laws and regulations, to make sure we're all starting from the same place, this slide gives a quick overview. So the Older Americans Act is a federal law. The Older Americans Act has passed both houses of Congress and has been signed into law by the president. Regulations are the rules made by federal agencies like ACL to guide the implementation of the law. Regulations are compiled in the Code of Federal Regulations, or CFR, and published in the Federal Register. So you might think about this as the law gives an outline and the regulations help fill in the details. Please note that states also have processes for state laws and state regulations, or your state may refer to administrative code or administrative rules or have some other names for these two concepts. And as a helpful hint, if you are told about a requirement that a law or a regulation requires, it's a good question to ask, is it a federal one or a state one? Or it may be both. The next slide shares some information about the Older Americans Act. So this law was first passed in 1965 and most recently was reauthorized in 2020. The current Older Americans Act has 7 titles, and the final rule focuses on 3 of them. Title III, which is grants to states, territories, and AAAs for supportive nutrition, disease prevention and health promotion, and family caregiver services. Title VI, which is funding for supportive nutrition and family caregiver services for Native American elders and caregivers. And Title VII, which provides grants to states and territories for long-term care ombudsman and elder abuse prevention, and outlines state responsibilities in promoting elder rights. And the next slide, some of this is what Allison shared. So while the law was most recently updated in 2020, the last update to the program regulations was in 1988, other than the Ombudsman Program provisions, which were issued and updated in 2015. And as we know, since 1988, the population of older adults has nearly doubled. Expectations for aging in community have shifted. However, one important thing has not changed, that older adults overwhelmingly want to continue to live independently in the community, and nearly 95% of them do. So in the next slide, just again to restate, we are so incredibly pleased to announce that as of this Tuesday, February 6th, the Older Americans Act final rule has been posted in the Federal Register, and it will officially be published on February 14th. Again, this is truly historic, 36 years in the making. And go to the next slide. So in preparing this historic update of the Older Americans Act regulations, we considered the following. Again, updates are needed to align the regulations to the current statute and reflect the needs of today's older adults. The rule also needed to address issues that have emerged since the last update and clarify a number of requirements. We looked at the rule promoting appropriate stewardship of Older Americans Act resources, and always thinking about how the changes made should better support the National Aging Network that delivers Older Americans Act services and improve our program implementation, again, with the shared goal that we all have of better serving older adults and family caregivers. The next slide notes that the rule is, again, the culmination of many years of engagement with the National Aging Network. It reflects input received through a formal request for information in 2022 and a series of listening sessions, including formal tribal consultations and other engagement with Native American grantees. Before finalizing these regulation updates, we issued a notice of proposed rulemaking, or NPRM, in 2023, which resulted in comments from over 750 entities. And we are truly grateful for the thoughtful, detailed input we received to truly make this a rule to support the National Aging Network and the older adults, tribal elders, and family caregivers we serve. So just a little bit of the process and timeline. Once we received your comments from the NPRM, our team reviewed everything and determined if and how to incorporate it as appropriate into the final rule. Our responses to comments are included in the preamble, and I'll explain what that is in just a moment. We appreciated a number of comments that helped us be clearer in our explanations. For example, we made edits to a number of definitions for consistency throughout the document. We also heard about the importance of innovation and meeting the needs of those in greatest economic need and greatest social need. So as a result, one example is that we modified the percentage of Title III C1 funds that can be used to support carry out or grab and go and similar meals. In other words, congregate meal program funds that can be used to support these types of meals, increasing the percentage from 20 to 25% under certain circumstances. Once we made modifications to the rule based on the feedback we received to the proposed rule, we then sent the final document through a series of reviews. And we, again, are thrilled that it will be officially published on Valentine's Day. So next slide shows important dates now that the rule has been finalized. And again, we want to, you'll hear us say this over and over again, we want to make sure that you know we'll be implementing the final rule over a reasonable time period. While the final rule will be effective within 30 days of publishing, the implementation due date is not until October 1st of 2025. So in other words, in federal fiscal year 2026. And for state unit on aging grantees that are unable to meet that due date, we'll have a supportive corrective action plan process in place. We anticipate that for the next 21 months, we will be taking progressive steps and providing robust training and technical assistance to help the aging network in implementing the final rule. Again, we'll emphasize, as Allison noted, that the vast majority of what is included in the final rule are long-established Older Americans Act requirements, affirming what's in statute, prior regulations, or existing policies, rather than creating new expectations. And they're not now all together in one place that hopefully will be easy to find rather than having to check multiple documents and trying to figure out which is the most updated one. So with that background, let's get into an overview of the final rule. As we mentioned, the final rule covers Titles 3, 6, and 7. So there's a lot of information to cover. Just for those of you that haven't yet looked at it, I'll give you a heads up. As a Word document, it's about 460 pages long. But we're going to break that today into pieces for our overview purposes, as well as in the coming months, we will have those training and technical assistance activities to help the Aging Network digest what's in the final rule and to digest it in manageable bites. So at a very high level, we'll start there. The final rule can be broken into two portions. The first is the preamble, and the preamble provides background information. It explains the different provisions of the rule, and it describes the comments received and our responses from the proposed rule. It also gives some information on required regulatory analyses, and it's about 2/3 of the entire document. The second portion is the final regulatory text in full for Titles 3, 6, and 7. And the next slides will continue to break that down more. Since it's not something that we do all the time, we included here as well page numbers on this slide for your reference, so you can see when you look at the document the different portions of it. And so the final rule, it will begin with a table of contents, and it will display the 3 sections of the preamble, which we'll review on this slide and the next. So this is the preamble, and numeral 1 is background. Numeral 2 is where we explain what we are changing for each of Titles 3, 6, and 7, and analysis and responses to the comments we received to the NPRM. So on this slide, for Title III programs covered in Part 1321, you'll see that this is further divided into 3 areas: what we revised, what is brand new, and what we are deleting. In the next slide, we talk about Part 1322, And this is for the Title VI programs. And you'll note that this is also divided into 3 areas: what we're revising, what is brand new, and what we are deleting. For Part 1323, which currently is for the Title VI Part B program specific to services for older Hawaiian natives, you will note that there is just one item here, as we are deleting this and combining the regulations for Title VI Part A and Part B. In other words, to combine all of Title VI into one set of regulations to reduce confusion and improve consistency in the provision of services under Title VI. And then finally, for Part 1324, which is for Title VII, we have both revised and new provisions. And the preamble ends with numeral 3, which is information on the required regulatory analyses. So we just walked through the slide and the one prior was the preamble. So about 2/3 of the document. Now we're going to turn next on this slide to note that the second portion is the regulatory text in full for each part. And again, just want to note how proud we are that we have these updated regulations, that we have it all together in one spot, that they clearly identify requirements as well as flexibilities. They will guide our stewardship and advocacy efforts, and again, support the work we all do to promote the independence, well-being, and health of older adults, tribal elders, and family caregivers across every part of our very large and very diverse country. Next slide. So with that overview, we'll now discuss some key focus areas and provisions addressed in the final rule. These are also reviewed in an expanded fact sheet ACL has prepared, and I'll share the links where to find that at the end of this presentation. So we'll start with the roles and responsibilities of state agencies and area agencies on aging under Title III. Key provisions include setting forth requirements on fiscal and service delivery, planning and service area and area agency on aging designation, conflicts of interest, and contracts and commercial relationships. So for example, in the next slide, the final rule clarifies requirements for state and area plans on aging, such as making clear that those plans must describe how state agencies and area agencies will use Older Americans Act funding, how greatest social need and greatest economic need are determined and addressed, and how public participation requirements are met. Plans must also describe how they will ensure coordination among the Title III programs that serve all older adults and caregivers, and Title VI programs that specifically focus on tribal elders and caregivers. The final rule also lists requirements for state agency designation of planning and service areas and area agencies. So as a note, on this slide and the subsequent slides, you'll see the section symbol followed by the number of the provision where you can find the specific preamble discussion as well as the specific regulatory text on these topics. The next slide has additional examples. Again, you'll note much of what is in the final rule is specifying types of policies and procedures Older Americans Act grantees need to have in place, and many of these that are already in place. So the examples here include regarding monitoring of programmatic and fiscal performance, and that policies and procedures align with ACL's data collection and reporting requirements. The final rule specifies that area agencies and service providers must also have and follow policies on client eligibility, assessment, and limitations they may have regarding service provision. So, for example, one of the important areas this final rule will clarify is around fiscal policies and procedures. And my prediction is that this provision of 1321.9 C2 is going to be a very popular citation due to all the very important fiscal items in this provision, some of which are listed on the slide, including distribution of Title III funds, match requirements, transfers, use of program income, private pay programs, and contracts and commercial relationships. So in the next slide, to go into further detail for the provision at the citation listed there, for example, ACL has been working to support the business acumen of the aging network for over more than a decade. And the Older Americans Act way of referencing this business acumen concept is contracts and commercial relationships. So using the language in the Older Americans Act regarding requirements for contracts and commercial relationships, the final rule clarifies that state units on aging must maintain a flexible and streamlined process for area agencies and service providers to receive approval to establish contracts and commercial relationships. And this clarifies and responds to numerous questions, comments, technical assistance requests, and conflict of interest concerns raised over the years on approaches to appropriately establish these relationships. The rule also clarifies that contract and commercial relationship activities are an allowable use of grant funding. And with these provisions, ACL is committed to promoting the establishment of contracts and commercial relationships while balancing appropriate stewardship of Older Americans Act resources. We move to the next slide. As related to contracts and commercial relationships, and a final example of roles and responsibilities of state agencies and area agencies addressed in the final rule, we'll review some provisions related to conflicts of interest. So stewardship of Older Americans Act funds includes ensuring that conflicts of interest are appropriately addressed at the individual and organizational levels, including that contracts and commercial relationships do not compromise the core responsibilities of aging network entities under the Older Americans Act. And these were important provisions to include and update, especially given that the scope of the aging network entities has changed so much since 1988. Being good stewards of public funds means we must ensure the integrity of and trust in the activities carried out under the Older Americans Act. And we address conflicts of interest in various places in the regulations, including the citations on this slide. In fact, one of the items we changed in the regulatory text in response to the NPRM feedback is that state agencies, area agencies, and Title III programs must document their conflict of interest mitigation strategies if they also operate adult protective services or guardianship programs. So in the next slide, we're going to move into a different topic area and a different major topic area addressed. And this is in serving people who have the greatest social need and greatest economic need, which is one of the basic tenets of the Older Americans Act. So as previously referenced, key requirements in the final rule include definitions of both needs, describing how those who meet the definitions will be served, and how perspectives of people with greatest social need and greatest economic need are incorporated into planning efforts. The next slide, we have some examples. So for example, the final rule establishes standard expectations while allowing state agencies and/or area agencies flexibility to include additional populations based on their local considerations. The rule requires state and area plans to include how they will reach the populations defined as having the greatest economic and greatest social need. Area agencies are required to have advisory councils, and at least half of the council members must be 60 years or older. And area agencies must make efforts to include people identified as having the greatest social need or economic need, and must include family caregivers and, when available, representatives of tribes, pueblos, and tribal aging programs. Service providers are also required to specify how they will satisfy the needs of those with greatest economic need and greatest social need. The final rule also addresses program and service-specific issues. For example, the rule includes updates specific to congregate and home-delivered meals and clarification of transfer of fund requirements. One popular comment in the final rule, or to the NPRM that we included in the final rule, was around use of congregate meal program funds to be used for carryout, grab and go, and similar meals. And as mentioned, the final rule allows for a limited number of such meals to be provided, subject to certain requirements, including that the meals complement the congregate program, and that use of the funds in this way is documented in state and area plans when they are to be used in this way. As also mentioned, a change from the NPRM to the final rule was a revision of from 20 to 25% of expenditures for the congregate meal program being allowed to be used in this way. As another service-specific provision example, in 1988, the Family Caregiver Support Program of the Older Americans Act did not exist, and the final rule does address this program, including with definitions of who it can serve and allowable uses of funds. Shift next to the final rule regarding Title VI, and this also has a number of important updates. As I mentioned, one key update is that Part 1322 relating to serving American Indians and Alaska Natives is combined with Part 1323 relating to serving those who are Native Hawaiians to reduce confusion and improve consistency of service provision. The final rule also specifies a number of program and fiscal requirements to aid Title VI programs, and it makes clear expectations for collaboration and coordination with Title III programs to serve Native American elders and caregivers. And we specify here, and we include that all parts of the aging network are responsible for coordination: states, area agencies, service providers, and Title VI grantees. Informed by our experiences in the pandemic, the final rule includes a number of important provisions on emergency preparedness and response. For example, the final rule specifies flexibilities in an emergency or disaster and requirements for when those flexibilities are exercised. And this is especially important as we know emergencies and disasters have distinct and disproportionate impacts on older adults and family caregivers. Again, we appreciate the feedback received in response to the NPRM, and it helped us to reorganize some of these provisions for clarity in the final rule. Last for our presentation now, but not least, the final rule addresses prevention of elder abuse, neglect, and exploitation, legal assistance development, and the Ombudsman program. And as a note, these provisions are separate from the Adult Protective Services rule that is also in process and anticipated to be issued as a final rule soon. So some sections in our Older Americans Act final rule, like prevention of elder abuse, neglect, and exploitation, and legal assistance development, are brand new. The legal assistance provisions that were revised include a number of important updates, such as confirming the role of legal assistance in promoting self-determination, defending against guardianship, and advocating for less restrictive alternatives. And the Ombudsman program rule, although promulgated in 2015, received some important clarifications and updates. The Older Americans Act was actually reauthorized twice since the 2015 Ombudsman regulations were issued, so the 2024 final rule includes updates to be consistent with the current law. All right, so we've gotten through an overview of the final rule and some of the key provisions, and now let's talk timeline and resources. So as previously mentioned, the final rule will be effective 30 days after officially publishing, which will be March 15th, and ACL will be providing robust training and technical assistance. through our plans to roll out the final rule, we will have roughly monthly webinars for the broad aging network that we will be announcing over the next year. As you can see, the rule covers a lot of program areas, so we will work together to manage it digest it in manageable bites. Again, much of what is in the final rule is reaffirming and better organizing what is in statute, prior regulations, or existing policies. And we know that we will need to work together to implement the rule. Having an organized way in doing this, this means that we will direct area agencies and service providers to work with their direct grantors. So in other words, the state agency or area agency regarding their questions, as the rule requires policies and procedures that the state agencies, and in some cases area agencies, will be responsible for developing and implementing. Again, the compliance date is not until federal fiscal year 26, so we have time to do this work, and we will have a supportive corrective action plan process if additional time is needed. Our goal is for this final rule to sustain the success of Older Americans Act programs and the aging network. It makes clear the requirements for Older Americans Act programs as well as flexibilities that are available. So some of the things that are in here are optional. The rule reflects the growth of Older Americans Act programs to which many of you in the Aging Network have devoted your careers. And we are grateful for your service and for getting us to this point. The rule is also here to provide support and guidance to those newer to Older Americans Act program implementation, and to those of you who are or will be future leaders of the Aging Network. We have a number of resources planned, and we will be making these slides available. We also will be posting updates to our regulations webpage, and the link is listed here. And so right now, you can see on there, you can get the link to the final rule as it was posted this past Tuesday. You can see some fact sheets that we have posted. Currently, we have some general fact sheets. One is a short 2-pager, and the other is an expanded 6-page fact sheet that I mentioned earlier, and that will give an overview of the final rule, and will cover some of the key topic areas that we talked about in this webinar. We will be adding to this site with additional fact sheets that are developed on key topic areas. The site also includes our ACL announcement and will include additional resources that as they are available. So for example, when we schedule additional webinars, when we have any other materials or resources. So we will be updating this page frequently in the coming year or two. We also will be having a number of other activities, including presentations at relevant Aging Network conferences and bi-regional meetings that our regional administrators will be hosting with state agencies. So more to come. You will definitely be hearing from us more as we go through this implementation plan. But most importantly for right now, the first in our roughly monthly webinar series will be a Back to Basics webinar on stewardship, oversight, and advocacy on the 15th at 2 p.m. Eastern. And so we will be sending out registration and more information on this webinar after we conclude today's webinar. So we can move to the next slide. And as my portion of the presentation concludes, I'll share the graphic that you may see in ACL's social media activities. I want to just congratulate us all for getting to this point. I can assure everyone on this webinar that those of us at ACL are excited to work with you in the Aging Network across the country as we implement this final rule. And so now, with much gratitude for his leadership and service, I will turn the presentation over to Edwin Walker.
Hello, Thank you, Allison, and thank you, Amy. First, I just want to emphasize that this really is historic, and I couldn't be more proud of this agency, this administration, and all who have worked to get us here. This effort has been, I'll tell you, so much more than any of us ever thought it would be when we started down this path. But it's so incredibly significant. It's significant in positioning the Aging Network for the future of meeting the goals and the mission of the Older Americans Act. And it's significant in responding to the increasing diversity of needs, of issues, and populations of older adults. The Older Americans Act, the Administration on Aging, and the Aging Services Network have really enjoyed a huge amount of success in its, well, it'll be 59 years in July. And I want to thank everyone, and I want everyone to know that I'm going to be on the outside, but I'm going to be looking for a huge celebration next year for the 60th anniversary of the Older Americans Act. You know, GAO has touted the Older Americans Act as a good model for federal programs because there's a very small federal presence at the top that doesn't prescribe, but instead sets out broad goals, priorities, and objectives. Further, it has established support and strength at the local level and provides and affords local communities, entities, and individuals to feel a very strong, I call it a sense of ownership of the program, and which leverages a tremendous amount of support. In fact, the most recent data shows a 4-to-1 return for every federal dollar invested. And after decades of administering this program, it really was time to update the regulations and to ensure that the program is very well positioned for the future. So this updated rule really ushers in a new era in providing guidance and direction and in investing in things to ensure our systems and services are strong and that they're capable of meeting and responding to the needs of today's and tomorrow's older population, but also the changing healthcare and home and community-based services environments that we're witnessing. And as you will see, this regulation provides updates and guidance to do just that. So to continue the success of the Older Americans Act programs, effective systems must be in place, and they must be in place to ensure efficient program operations and proper stewardship of resources. You see, we are aware of recent significant amounts of turnover of experienced staff with critical institutional knowledge at all levels of the Aging Services Network. And at the same time, we're learning of increased interest in appropriate levels of program and fiscal oversight of recipients of federal funding. And this includes by potential partners in the expanded recognition of the Aging Services Network as the providers of the social determinants of health to really help complete the healthcare experience for people by achieving good health outcomes. To assist in filling these knowledge gaps and to promote prudent stewardship practices, we're implementing what you've heard about, this Older Americans Act Back to Basics Technical Assistance webinar series. And this series is coinciding with the implementation of the updated Older Americans Act regulations. These regulations are designed to advance the policy goals of the Older Americans Act, including equity in service delivery, advocacy on behalf of older adults and family members, appropriate accountability of funds, and efficient administration and oversight of these public programs. Because we recognize that much has changed both in the Older Americans Act and in grants administration since the 1988 Older Americans Act regulations were issued, it's part of the stewardship of the Older Americans Act in this next year that we're going to be providing this robust set of training and technical assistance resources through a variety of mechanisms, webinars, tip sheets, frequently asked questions, and other materials. And we intend these resources to provide the Aging Network with the tools to build successful approaches to program implementation, administration, and management, as well as the necessary processes, procedures, and documentation to demonstrate appropriate oversight, stewardship, and accountability. So you could answer and respond to anyone who asks and show the success of this program. We are scheduling this first webinar, as Amy indicated, on stewardship, oversight, and advocacy responsibilities next week. So please register as soon as the link comes out. So as I prepare to end my 40-year career, 32 years here at the federal level, 8 years back in the state of Missouri, this career of working in and implementing the Older Americans Act, please know that this really has been my life, and one that I have truly loved, and one that I'm honored to have had the privilege of serving in. I want to again thank everyone who worked to make this updated regulation a reality. Allison mentioned it. When she first came on board, I told her I was thinking about retiring, and she said, well, what do you want to accomplish? And I said, I want to get the Older Americans Act regs out. I also said, I want to get the APS regs out, so stay tuned. But I really want to thank those who helped draft, those who, it's a range of people, those from those who were working on drafting, to those who were just thinking about things, to those who helped us refine, to those of you who provided input, to those here who analyzed comments and your input, to those who helped review, to those who wrote and rewrote, and to those who actually challenged us on the concepts and the policies we had. And finally, to those who actually helped us push through this regulation, through the multiple clearance processes that are as part of this process. It's been refined and vetted in so many different ways. But I want each of you to know that you've played a significant role in improving our national system of services for the future. You know, the history of the Older Americans Act is one of tremendous success, and your efforts in developing and implementing this regulation will do nothing but build on that success. Last, I want to indicate that I couldn't be more pleased that on Monday of next week, I'll pass the baton to Carrie Benson from Minnesota. She will carry on the role of leading this very noble mission. She has a distinct passion for these issues, both personal and professional passion. And she spent a career dedicated to this world, our world of aging services. And I know she's going to be great. So I ask you to give her your full support. And I thank you, each and every one of you, for the partnership and the support that you've provided me through the years. Thank you for your dedication and for your commitment to enhancing the lives, maintaining the health, and providing essential supports to those most in need. Your work has resulted in displaying the true compassion of this nation. And as Hubert Humphrey indicated, it's a reflection of the moral tests of a government and how it treats those in the dawn of life, in the twilight of life, and those who are in the shadows of life. So thank you for being a critical cornerstone in the foundation of our country. Back to you, Allison.
And as others are maybe coming on for any final comments, this is Amy again, and I will just note that definitely the PowerPoint will be posted. We are making a recording of this session as well, and the best place to go to find that when posted will be at acl.gov/OAA rule. We also will be sending information out on our through our ACL announcements. So you can sign up for those and get information there. And we will look forward to sharing this information in a variety of ways, a variety of times, again, because we know it's a lot of information, but we also know we have a very large aging network that covers this country. And we want to make sure that everyone is able to receive the information.
We want to thank you all for joining us today. And I do believe that this will conclude this presentation, and we look forward to your participation in the future sessions that we have. Thanks again.